Hi, instead of making one Marco Polo for each individual, I decided to just do one video and see how it works. So it's really intended for a number of sponsors from different hurts, happens, and hangups to accountability partners and friends and people that I associate with and brothers and sisters in the faith in general. So just to give an update, last Wednesday on the 16th of August, my mom had a stroke. A friend from the Cause Church, actually in Fullerton, had invited me to lunch, and I was going to meet up with him. And I took my mom, who's 84 years old, and I caregive for her. So we were passing by Whittier PIH Hospital Presbyterian when she had a stroke, and I immediately went into the ER there at the hospital, and they are a stroke facility, thank God. Within half an hour, they had already diagnosed that she had a blood clot, and she was being operated on. She actually had the blood clot removed and a stent put in, and she was a lot more alert. There was obviously a lot more oxygen getting to the brain, a lot more blood. So she was actually walking very well. Anyways, fast forward to now. It's now Saturday. I don't know what, the 26th, I think, and time just kind of froze. I'm still thinking it's the 16th, but we ended up having to take her back to ER, back to PIH, transferred over to Baldwin Park, Kaiser, and several times throughout the week. And I was at Baldwin Park, Kaiser on Sunday when the hurricane hit, which was there was rain, but I mean, and for California, I guess it was a big storm. But anyways, and I'm not belittling the fact that certain cities did have like major inundations and things, but I was on the fifth floor when the earthquake hit, and I could feel. I was right by the window, and I could feel it rolling, and that was not something I enjoyed. That's not the kind of e-ticket I want. But so we left Sunday around 4 o'clock, Baldwin Park, went home, and mom had actually been walking very well with physical therapy. But by the time we got home on Sunday, around 5 o'clock, she couldn't move the left leg. She had lost all mobility on the left arm, left leg. So back to ER and back to being transferred to Baldwin Park, and basically I tried to take care of her at home after that, and I ended up hurting my back, not badly, but it and I, anyways, as far as the back is concerned, it's obvious that I'm not strong enough. She's a little bit heavy, and I cannot really take care of her at home. So I was thinking of putting her into they had asked me whether I wanted her in a skilled nursing facility, and I had said no. I could try to take care of her, which is really what I want to do. It's actually a couple of nights ago, I had just seen a Love Boat episode of I guess an older gentleman. I don't remember who the actor was, but crying, telling the daughter, "Don't throw me away. Don't put me in a nursing home," and it was very touching. And then the next day, and end up having to go back to ER, and they said, "Do you want to put her in a nursing facility?" And I said no, and back home, and then here we go again. What ended up happening was, I told Kaiser on Sunday, her urine smells like fish. What's going on with that? They're kind of like this really heavy ammonia scent, and they didn't do anything about it. The reason I know is because someone from Kaiser looked into it, and they said no, they didn't do any urine tests. And if they had, they would have noticed that. Obviously, they should have known just by the smell. So you have to be careful. Anyways, so she has a urinary tract infection. So that was what was it, Friday? Yeah, I guess Friday we went back to ER, and they transferred her over to, again, ER Baldwin Park from PIH. So it's been a lot of coming and going, but you know what? The staffs, the ERs have been really good. The people have been really supportive, and so anyways, I'm now leaving Baldwin Park. Again, it's around midnight. Was here. I don't even know what time I got here. Around 4 o'clock. My aunt was kind enough to come in from like 10 to 4, basically. The two younger siblings, again, I asked one and she just keeps blowing it off, and the other one lives in San Diego, so she's using that as an excuse. And that's just not the way we were raised. We were raised to take care of our own, and which just makes it difficult for me to put my mom in a nursing facility. The reason they haven't transferred her out of ER to a skilled nursing facility is because they sent out, I guess, requests for a bed, and it has to be a specific facility. It has to be able to give prescription medication, check the vitals, obviously check the urinary tract infection, and deal with physical therapy and the mobility issue and the dementia on top of all that. So it's not just any skilled facility, and it's not just any nurse rehab facility. So they're looking for one in Downey, close to our house, which is in Pico Rivera, and they haven't responded. So the social worker, the case manager, said, we'll wait for tomorrow and see what happens. And this is LA County, so it's huge. So I said, please don't don't send her to Thousand Oaks or something, Century City or something like that. But at this point, I don't know. I'd like to keep her close. And anyways, the reason I'm doing this video is because I want to touch bases on some of the triggers. Mom, obviously there's the codependency, there's the anger management, there's the just tiredness. I don't know, that must be some kind of hang up or hurt or habit, or I don't know. But when I arrived, one of the nurses, male nurse, checked her diaper, and they had this little, I don't know what they call it, a wing tip or something, so like a little portable disposable catheter they put on women, and it's possibly even men, but basically it collects the urine, and it gets sucked into the container they have against the wall. And so anyways, he looked to see if she had soiled herself, and he said no, she's there's some urine, but I mean it's the wingtip or catheter's catching it. And she didn't smell, so we didn't think much of it. And then when the shift changed, he was leaving, and I said, can you check it? And he checked it, and again, nothing. When the new nurse came, maybe around 9 o'clock, my mom had said she wanted to go to the restroom, so they checked it. Sure enough, she had pooped, and it was crusted. And so that means they had been there for a while. And, so obviously, I understand being a male nurse, you don't want to be changing somebody's diaper and cleaning them, but I'm not blaming him. I'm just saying, because he looked. I mean, I didn't look, but I didn't smell anything, so I understand. But when the nurse changed my mom that time, when again 9 o'clock, I saw what she was doing, and it wasn't easy. It wasn't trivial, and she was really digging in to get that poop out of the hole, And she goes, here's the biggest problem with the urinary tract infection. If it gets into the more forward private part, it gets infected. You're just putting waste into that area, that very sensitive area. And urinary tract infections are very common with elderly people, women. So anyway, she cleaned her up, and guess what happens? About 5-10 minutes later, all of a sudden mom poops, and I'm like, oh man. And so I wait till my sister arrives, so around 11 o'clock, because they were packed. I mean, ER was packed. It was swamped. And there was just nothing I could do. I mean, I told the nurse, I said, I'm sorry, I think she pooped. And she goes, okay, I'll be back. And I knew it was going to be hours, and sure enough. And it wasn't like she was blowing it off. It was just, I was patient. But going back to the anxiety and the... I don't know. I don't even. Maybe I need to carry my little list of hurts, habits, and hangups. But hearing my mom moaning and groaning, it didn't bring back the moaning and groaning of Dad when he passed away in December. So it didn't trigger that. It didn't trigger the grief. It didn't trigger the shock. But it triggered. I guess the anger is like I really didn't want to hear it, and there's nothing I can do. It's like the desperation of being able to want to do something, but there's nothing you can do. There was just no way I could change her diaper. And it made me think, okay, I need to send her to a nursing home, because I can't do this at home, especially by myself. Even if the two younger sisters showed up out of a miracle, but they're not going to. But I mean, it's just not something I can do by myself. and several times a day, it's just not possible. So, anyways, the nurse, my sister did arrive around 11 p.m., and then the nurse came in, and came in with another nurse. So you got two RNs that are trained, and it took them about 10 minutes to change my mom and again clean her up real well. And I was seeing how they were cleaning her up, and they were cleaning up real well. And the reason I'm saying this, because if I was to move my mom from the side, to bend, not bend her over, but bend her to the side, and clean her, it's, she's going to be crying and moaning and groaning, and I'm not going to want to hurt her. And they got a job to do, and they're doing it, and so the job that they do is going to be a lot more thorough than what I would do. So I guess I'm going to have to live with the fact that I'm going to have to send her to a skilled nursing facility, because I told my sister, I said, maybe we should keep her at home. And it's just, after seeing this, it's like now the problem is that the nurse did tell me, she said, if these places have one nurse for maybe 40-50 people, and I know from experience from a friend, there was one nurse during the night, there was two, but one would go to sleep, and so basically there was one for, like, each of them had 40 patients. That means all of a sudden there was one for 80 patients. So what she told me is, what some people do is they actually hire a caregiver, like a nurse, someone that's training or getting their degrees, or they're going to school to be a CNA or a RN or some kind of, whatever the degrees are, and basically sit there with their parent, their loved one, at the nursing facilities, and change them. So you're still paying for that caregiving, but at least someone's there that has been somewhat trained. I don't know how women do it with babies. I mean, the baby's a little thing, but still, I mean, and it's not, at this point, it's not even the smell. It's just, how do you do it properly, and then sticking your hand into your mother's, parts to be able to clean her properly, and while she's yelling and maybe even cursing me for doing all that. It's tough. It's tough. Just keep me in your prayers, and my mom, and what I want is, just guidance and assurance that I'm making the right decision. I don't feel like I'm throwing her away, like in that Love Boat episode. But one thing that has happened this whole week, and I think it's just kind of worn off, when I first took her to ER, during the stroke, after she did get out, after they moved her from surgery to intensive care, I sat with her, I don't even know how many days, but I'd go home, maybe sleep a couple hours, go back. But sometimes I would turn and see her, and I wouldn't see her chest rising, and I was like, oh my God. It just brought back those emotions with Dad. And it was like, relax, there's nothing you can do. I mean, what are you going to do? We have a DNA, do not resuscitate. And they asked me, are you sure you want? And I go, that's part of the directive, it's already been decided. And I tell them, just to see what they say, basically help them think it through. I said, if you can resuscitate her without breaking any ribs, that's fine. And they're like, no. And I'm like, exactly. I don't want her coming back as a vegetable, or an old woman with broken ribs. And she's made this decision. It's just not me. Anyways, thank you for listening, and thank you for the prayers, and people have been so wonderful. I mean, in my previous church, again, not wanting to dig this up again, but anyways, beat a dead horse, as they say. But I would send out a text, and I might get a thumbs up from an elder, like, or a prayer emoji, and it's like, come on, you're supposed to be a shepherd, and you can't use a scripture. You can't take the time to send a scripture. Google it. I mean, do something. What's the point of being one of these Bible thumping Christians that supposedly 7 days a week, 24 hours, when you can't, when push comes to shove, you're not there for someone that you're supposed to be shepherding. And so, anyways, with Celebrate Recovery, with all these people that I've met, some of them don't even know me; they just know me from Celebrate Recovery. I mean, they were kind enough to give me their number, and I text them, and they said they keep me in their prayers. They actually send me a prayer, and it doesn't have to be scholastic or any profound. It's just Lord, keep Jose and his mom and and your prayers and your thoughts are, you know. So it's the CR family has really meant a. I understand that expression. It's in my um, testimony, but when I wrote the testimony, I was writing it before I had this experience of really understanding what the CR family is, and so it's pretty powerful. All right, you guys have a good night, and God bless you. Thank you.